Hello and good morning, everyone. I am Life Coach Shereka Dunston, and today I am so excited to end Black Maternal Health Week with Dr. Kari. So I will give just a moment for folks to, see us live and join us, and we'll get started in just a minute or so.
Awesome. I'm so glad to be here. Thank you for having me.
Thank you. It's been a while since we've seen each other.
Yes, undergrad days. A long while. I I like to think
Seems
that
so
that was
long ago.
I know. I was going to say I like to think that that was a shorter time than it actually was. But time waits for no one.
That's so right. All right. So let's go ahead and get started. You know, if you are joining us live, please put live in the comments. If you're catching the replay, I know it's early on a Saturday morning. Please put replay in the comments and share this with someone who may need it. Um, you know, I am Life Coach Shereka Dunston. For those of you who do not know me, I am the co founder, along with my husband, Chris, of Family Strategist LLC, doing business as Black Life Coach Connection. As I mentioned before, today is the last day of Black Maternal Health Week. This week is the creation of Black Mamas Matter Alliance, which is a national network of organizations and leaders from the maternal health, human rights, and reproductive justice fields. They believe that every woman deserves access to quality and holistic health care. And this year's theme is claiming our power, resilience, and liberation, which I love so much. This is an opportunity for Black mamas to be heard, an opportunity for intentional change geared towards dismantling systems and uplifting intersecting oppressions that disproportionately impact Black mamas the hardest. And these things resonate with me. As folks know, not only am I a life coach, I'm a social worker, but I'm also a Black mama to two precious babies. And I like to think that my birth stories did not happen in vain. um they were hard, so this is giving me not only an opportunity to share my stories to encourage other Black moms, but it's also giving me an opportunity to connect with an amazing physician to talk about this subject. So, as you see here, I'm joined by Dr. Kari, who is amazing. We go way back to 2004,
Yeah.
when we were both Eagles, young Eagles in the yard. Um, so, let me tell you a little bit about Dr. Kari. She is a board certified physician, inspirational speaker, community leader, daughter, best friend, and woman of unwavering faith. Originally from Washington, D.C., she has lived and learned in a diverse array of communities and has weaved all of her experiences into a unique worldview that she shares through her ministry. Led by the Holy Spirit, she made Columbia, South Carolina her home in 2015, where she completed her residency training in family medicine and is currently serving as a professor of academic family medicine. Dr. Kari is known as an expert on maternal child health, diversity and inclusion, and community physician partnerships for wellness. Welcome, welcome, welcome.
Thank you. So excited to be here this morning.
It's, this is such a needed conversation. And this is exciting work. And it's a blessing that, you get to help people bring life into this world. Like, how amazing is that?
Yes, I am
That's
truly honored. I am grateful. I'm overwhelmed with gratitude all the time that I was chosen to do this work. And it's exciting, but it's also daunting and exhausting that we have to keep asking for our value, our dignity, to be recognized over and over again. And so I would love to hear your birth stories. But I will say that there are so many tragic and unfortunate birth stories that our Black women experience. And we are trying to change that narrative all over this country. So I'm really grateful to be here. I'm grateful to be doing this work. Um, and I'm grateful to Black Mamas Matter Alliance for ringing the alarm, for getting the awareness of Black Maternal Health Week out nationally. They are doing amazing work.
Certainly. So I will briefly describe my birth stories because it's important, for people to give voice to these matters, to give voice to these things. And, my friends know I don't mind talking about the uncomfortable things because we have to get a little uncomfortable in order to grow and to make change in this world. So I've been a mama since 2010. Woo, that sounds like a long time, y'all. I got a 10-year-old. That's crazy. But I became pregnant when I was 23. So I was young. I didn't know anything about birthing no babies, as they say. And it was a fairly easy pregnancy. Um, and I had a birth plan. My husband and I went to the Lamaze classes. My birth plan said unmedicated. I wanted to do natural everything. Um, but I didn't know I would be in labor for literally over 24 hours. I didn't know about back labor. Nobody told me that. None of my friends had mentioned that to me and how it's crazy and you feel the contractions in your back. So, I was like, okay, this is different. This was not a part of the plan. I thought once I went into labor, I'd be able to call a doctor and go to the hospital. No, he's like, stay at home. You're not ready yet. And I was at home for a long time, y'all. So when I made it to the hospital, I was excited. I'm like, this will be great. I'm going to push out my baby girl. This will take a few hours. It took forever. And unfortunately, my baby went into distress while I was trying to push. Um, and I was scared. I was looking at the monitors. I saw her heart rate decreasing, and I was like, oh no. And, they gave me oxygen. It didn't help. And then I was under the care of family medicine doctors. So there was nothing about having a cesarean section in my plan, in my thoughts, nothing. But every time I pushed, her heart rate decreased. And so I got scared. And the doctors are like, okay, we have to go consult someone else. And I was like, oh no, oh no. And I told my husband, I was like, I think I will end up with a cesarean section. And I was like, but I just want her here because it's been forever. Like, I've been going through this. I'm weak. I'm tired. And there was this nurse. While the doctors were out, she was like, no, you're going to keep pushing. And I'm like, are you sure? They said to stop pushing. Something's wrong. And she literally stood in front of the monitor so I couldn't see my daughter's heart rate go down. And she made me push anyway. And I was like, this doesn't feel right. And the doctors came in and they were like, no, you're having a C-section. They found some things wrong where honestly, I could not give birth naturally. And it was, some people say, oh, cesareans happen because you don't try hard enough. No, like anatomically, I couldn't push her out. And I had a tiny 5-pound baby. So, willed to the OR, things were okay. They weren't the best. But the thing that stayed in my mind was that nurse who took it upon herself to try to make me push. And I was like, that was crazy. Why would she do that? Why would she cover up the monitors? Was she doing that because I was a young Black mother? And I was 24 at the time, but I had a baby face. And I was like, she probably thinks like I'm this unwed mother, despite my husband being right by my side and I don't know anything. And she probably didn't know my parents were there. I just didn't want them to see me like that. And, so like I had a support system and none of this was a part of the plan. So that weighed heavily upon me. But I got through it. Me and my baby had to stay in the hospital for like 5 days. It
Mhm.
was a lot. Unfortunately, after giving birth to my daughter, about 3 weeks later, I had an infection. So I ended up in the ER. Once again, not a part of the birth plan. And, things weren't so good, but we got through it. Um, Fast forward a few years after that. And at that time, I will go back and say, I was an educated Black woman. I was enrolled in my first master's degree program when I gave birth to my daughter. I was working as well, so my husband was working, professionals, everything was all good. But, that nurse did not see us in that light. I think she would have treated me differently if I looked differently, honestly. So fast forward a few years, I was back in grad school. I'm an overachiever, y'all. Maybe a little bit of a nerd, but that's all good. So I ended up getting pregnant again in 2015. Unfortunately, that pregnancy ended up in a loss. And, you know, it didn't make me less of a mom, though. And so my heart goes out to women who have experienced miscarriage because I know that pain. And once again, going through that scenario, interacting with doctors, I had this doctor who literally looked at my face and told me, she was like, I mean, I don't know why you're so upset. You're young. I was like 29 at the time. She was like, you have plenty of time to have a baby. And I was literally crushed, depressed. And I'm like, wow, did she say that to everybody? Or is it just me? Like, that's not what I wanted to hear at that time, you
Mm.
know? Um, and the nurse from before with my daughter's birth, she was a white woman. This white female doctor told me basically to get over my miscarriage because I had plenty of time to have babies. Um, it hurt. It hurt a lot. So, fast forward once again, 2 years later, I was in my last year of my second master's program. I was pregnant again with my son, my rainbow baby. And it was a smooth pregnancy. I knew I was having a repeat C section. It was scheduled for right after Thanksgiving. It was going to be all good until I'm laughing in labor and delivery and his heart rate dropped. And I'm like, oh no, this again. And they were like, we have to rush you to surgery right now. And I'm like, what is happening? But it was different this time. I didn't have to labor that long. I was okay. I've been through a C section. I'm ready. But things turned rather quickly. It all started with like the epidural. It was not working. It didn't go in right. It took forever. And I'm like, what in the world? And then they're okay, whatever. We don't have time to like count the instruments. You're going into surgery right now. And I'm like, what? Where's my husband? He made it in the room barely. Um, but that C-section was a lot different. I hemorrhaged during that C-section. I could feel the life leaving my body. I literally knew I was dying. And I couldn't say anything to my husband because I was scared to honestly speak. I was literally praying and pleading with God to let me stay there so I could be there for my husband and my daughter and my son. And my son, he was out, he was fine, beautiful, perfect little baby boy. But I was literally on that table dying. Um, And I remember the anesthesiologist being next to me, and I looked at him, and the only things I could say was like, "I think I'm about to pass out." Which in my mind, I knew I wasn't passing out. I thought I was about to die. And he was like, "Okay." And they jumped to action. He listened to me, and they saved my life. And I won't go into graphic detail, but I will say this: the room looked like something from a horror movie because of the amount of blood I lost.
Wow.
Um, it was terrible and it was scary. And apparently my husband was like praying right beside me. Um, they say the prayers of the righteous availeth much, and I believe that truly. My life was spared for whatever reason. Honestly, I think it was divine intervention, but I'm so grateful to that anesthesiologist who listened to me and who took
Yeah.
me seriously. And he was a white man, but he actually listened. That was the difference. He treated me with compassionate care, and they did what they had to do to save my life. It's interesting because like a year or two passed, and I went to look at the notes from that cesarean section, and I saw how far my oxygen levels had dropped, and I was like, oh my gosh, like I was almost out of here. Um,
Wow.
I'm just so happy that, the third time was the charm with my medical professionals and my birthing stories. Um, but at that time I knew like I would never give birth again because it was all so scary. It was hard. And I was pursuing my second master's. I had a career. My husband had a career. We were fine, middle class Black people. So these horrors during birth, they don't just happen to people who, are low income, living in
Right.
poverty, single moms. They happen to all of us Black women, you
Yes.
know? And
Mhm.
that's the scary part.
Yeah, it is.
So I will stop there, Dr. Carey.
Thank you so much for
That was
your
a lot.
Yeah,
Sorry.
no, thank you for your vulnerability. Thank you for your passion. That experience is driving you to advocate for other moms. Um, the thing that you said that resonated over again in my head is he listened to me. And what we're finding is that in almost every single case where something did not go right, the women say, my doctor didn't listen to me. I knew something was wrong. I told them something was wrong. Even if I didn't know how to articulate it well, I said, something is going on. Help me. And the doctor did not listen. My voice wasn't heard. And so um, I think that the reality is that it might be as easy as listening to Black women. That's why I have this t-shirt on. Black women are perfect in their own experiences. Black women are experts in their own bodies. Black women are able to articulate and have autonomy over what is happening to them in the moment. So maybe the answer isn't that we eradicate all of racism, all trace of racism in this country. I don't know if we'll ever get there. Maybe the answer isn't practicing perfect medicine every time. Maybe the answer is listening to Black women and honoring their experience in the moment and acting accordingly. You said something which I'm grateful you were even able to articulate that and get that out. You said something, they listened, and they changed their course of action to accommodate the new situation. It went from a planned C-section to an emergency C-section, and that's one of the things. So I am a professor of medicine. I teach residents and medical students all the time. And I just had this conversation last week. I said, one of the biggest tools you can have, one of the sharpest tools in your box as a doctor is to know when you've gone from a stable, clear coasting, planned situation to an emergent, we have to act right now situation. And you have to be able to adjust. We see that in all types of professions. I won't call any names, but all types of professions where you have to make split decisions. And those unconscious or sometimes conscious biases play into how you respond to that human being, to that scenario, and what your next action will be. So, thank you again for sharing that. Again, I work with a researcher here at the University of South Carolina, along with myself, and she did a study on Black mothers' choice whether to breastfeed or bottle feed at the time of birth. And for many Black women, they said, the doctor didn't listen. I wanted to breastfeed, or I wanted to have a medicated birth. I wanted, and no one listened. So that is a very common prevailing theme that we're trying to, on my side of it, where I'm training other physicians, I'm coaching my own cohort of fellow physicians. That is one of the messages that we send home every single time. Listen to Black women and listen to all women, because let me be very clear, racism hurts everyone. What you do to Black people, when you set up an imbalanced system, you're still left with an imbalanced system. I don't know if you've heard of the new book that's coming out. I think it's called Draining the Pool. It is about in Chicago, a Black kid jumped in the pool. They drained the whole pool and they never fill the water back up. Dorothy Dandridge dipped her toe in the pool. They drained the whole pool. They never filled it back up. And so, what if you have a city or town with one pool, and you drain the entire pool just so a Black person could not swim in it? Nobody can swim. And so when you look at the American health system, our numbers for maternal mortality are staggering and daunting compared to Western Europe, compared to some, even some nations in Africa, New Zealand, Australia are doing so much better than we're doing, because we created an imbalanced system based on racism that was perpetuated from a historical context even to now. And because it was rigged against Black women, it has harmed every woman in this country, and it has made our system less safe for everyone, particularly Black women.
Wow. That, that's that resonates with me, not only as a Black mama, but as a social worker. You know, racial justice is it doesn't just help Black people, it helps every person.
Everybody.
Equity does not just help the lowest of the low, it helps everyone. And it's a shame that we are in 2021 and we still have to have this conversation on so many different levels about so many different things. And when you think of motherhood, motherhood should be something, that excites and makes everyone happy who's ready to be a mom, who chooses to be a mom, of course. And it should bring us together. We shouldn't be faced with thinking about our mortality when we go to have kids. Like,
Right.
you have the baby shower, everybody's excited, it's time to go to the hospital. Yes, she's on the way to the hospital. And then you get to the hospital, like, oh gosh, will I make it out? Will my baby make it out? Like, it's
Yeah.
crazy.
Yeah,
It's
and
crazy.
we're in this weird space right now that's really uncomfortable, for me as an advocate and activist, because on the one hand, I have to ring the alarm. I have to be loud, be out, nag, badger, and be very public about the outcry, because our women are dying. On the other hand, I'm having to find the balance of supporting Black women so that we're not overcome with fear, that we can still celebrate those moments and be excited about life and birth. And also a coaching element on how to approach your healthcare team, not from a place of fear, not from a place of hostility, expecting that they will be racist, but from a place of empowerment and collaboration, so that your voice is heard and their voice is heard. So I'm coaching from both sides. It's an interesting place, because most coaches are coaching for one team, and I am on both teams. And I have to remind myself that the reality is that it's the same team, that I am pulling for humans to value and respect and love and care for humans, whatever those titles are. But it is a very interesting place, because now that we are informing people, an unintended consequence of that can be that fear, that hesitancy. And like you said in your own story, I've heard women say, I'm never getting pregnant again. I don't want to do that again. And so, how do we continue to honor the experience of a woman being excited to give birth, or a birthing person to be excited, and yet also maintain a sense of lucidity and clarity, that they have to be aware and to be advocates for themselves as they go through the process.
Yes. I like how you said, you're coaching for both teams, but honestly, it's the same team. and getting people to see that, because I would hate to think that a pregnant person has to think, oh my goodness, I have to advocate for myself with this doctor. And it's like me versus the doctor. When honestly, the goal should be to have a healthy parent, a healthy baby at the end, and everybody's happy and healthy and, yay, the baby's here. Um,
Yeah.
wow,
And for the
that's
majority of
that's
us,
deep.
that is what it is. That is the experience. Unfortunately, the stories that are the most graphic, the most horrific, are the ones that rise to the surface most of the time. But the problem is that those instances are not isolated cases. There is a pattern, there is a predictability to outcomes. And so, while we can why I can confidently say that myself, my partners, most of the people that I know and deliver babies with are on the same team with you and are pulling for everything to go well. We do know that even with the best intentions, that the subconscious biases can come into play. And perhaps we were too busy trying to give equal care that we weren't giving equitable care. Meaning, instead of saying, I'm colorblind, I treat all my patients the same, everybody gets the same orders, everybody gets the same, delivery style, that we should have been and hopefully are moving into evaluating each patient's needs, from even preconception through prenatal care and into delivery, and saying, how do I make an adjustment as the physician, as the provider, as the one with the power in this scenario? How do I adjust to make sure that I'm compensating for what my individual patient needs? And constantly being aware of that. When I do my anti racism training, I'm always saying, everybody has bias. Everybody has bias. I do different exercises and scenarios. I'll do a bank robber, or I'll say, you're a patient in an office. You need a minor surgical procedure. The doctor storms into the room, rushing. They have a million patients, and they come in, they shake your hand, and they start asking you what's going on, and then I'll debrief. I'll stop and I'll say, what race was the doctor? What gender was the doctor? What how was the doctor dressed? And what I tell them is, your imagination created a doctor's office, created a need for a surgical procedure, created a doctor. Your bias gave that doctor gender, color, skin color, hair color, eye color. And usually, and I start off there because usually people are like, oh, got it. I can go to my closet. There's so much more red in there than there is green. We all carry biases. And if we can learn to, one, acknowledge that, two, address it, and then three, adjust for it in the moment, then we can start to overcome, and provide that equitable care, even in those split second decisions.
I love it. I love it. And these conversations about implicit bias need to happen in so many different spaces. So, I work in gender based violence prevention. I have these conversations when I'm talking to students at the university where I work. I'm like, your biases will impact how you choose, or if you choose to step in when you see harm occurring, to be a bystander that's active or inactive.
Right.
It shows up everywhere. And it's so important to normalize that we all have biases.
Yes.
Implicit bias is not a bad word. What you do with it, that can be not so good, and that can have outcomes that don't help people. So I'm so
Yeah.
glad you're doing this work and having these conversations.
Thank you. And I'm glad you're doing the work you're
So
doing.
you're welcome. No, it's all needed work. We got to do so much to try to change the narrative and
Yes.
to change culture, because
Yes.
that's what it's all really about. Um, So this is my last question about this whole maternal health concept, I guess, and advocating for Black women and other women in these spaces. What advice would you give to a mom? And I'm not talking about medical advice, y'all. Don't go back and say, Dr. Carey said I needed to do this. That's not what we're doing today. But, what would you say to an expected Black mother or any, expected mom when it's time to have those important conversations about their birth plan and, in the moment with their doctor?
Yeah, thank you for asking that question. I love speaking directly to expecting moms, new moms. The first thing to do is to educate yourself on the process that you're undergoing. Your body is changing rapidly. Your life is changing rapidly. Your social status, your social connections, your family life is changing. So, getting as much education as you can. That's going to include following Black Mamas Matter Alliance, following doctors like myself, Dr. Joya Perry, who are constantly using social media, our mailing lists and tools to really educate as much as we possibly can. And then asking questions. So, if you even going on Google and doing a quick Google search can show you what you should expect at your very first pregnancy prenatal care visit, what to expect at 28 weeks, what to expect at 36 weeks, what going into labor feels like. So, I encourage my patients to keep a notebook or a book of some sort. Write your questions down before you go in. Ask about, well, I saw that I'm supposed to get a Tdap or vaccine or a flu shot at 28 weeks. How should I prepare for that? Is that something you all offer? Those types of things. So coming in informed, prepared, and then having your notebook with you to write down the answers to your questions that the doctor gives you. So sometimes you can forget things. One of the things I love, so I do a group prenatal care. And with group prenatal care, we give our women journals, and it has information on what to expect at every step of pregnancy and new mom life. But it also has a place for them to write down their vital signs. So every visit, you should be writing down your own blood pressure. What did you weigh that day? What was the baby's heartbeat when they did the Doppler? Um, is your baby vertex or not, which means baby's head down, ready for labor? What was your fundal height, which is going to be kind of how round is your belly? Is your belly getting bigger? So, those are details I have every single patient write down every single time. Here's why. Not only do my patients write this down, my patients take their own blood pressure. My patients weigh themselves on the scale. They come to me and they're like, Dr. Allen, something wrong with your scale because I'm 10 pounds more than I was last week. Can you recalibrate it? That's not right. And we'll go and recalibrate the scale. I had a nurse one time put the scale on the carpet, and the scale reads heavier on the carpet than it does the hardwood floor. And it was my patient who was like, I think we need to move the scale. So they are not only informed, but so empowered about their own um, statistics, their own data. So fast forward to a story I had a patient who had been writing down her blood pressures every time. Her blood pressure was usually, let's say, 104 over 79 something, or 70 something, normal, very low normal. So every time she comes in, this is what it's looking like. We get to the hospital and her blood pressure was like 129 over 85 or something like that. Something that's still technically considered normal. Maybe it was 135. But she was able to say, well, my blood pressure's never been over 110. That's 20 points higher than it usually is in the office. Is something wrong? And so she was able to alert the staff before the staff would have even been alerted, because that was still a normal blood pressure, but it was very abnormal for her. And so then we were able to start the preeclampsia and hypertension workup even sooner. And so those are the types of things. For many practices, the nurse will take your blood pressure, they'll take your pulse, They never even really tell you the number, or they may say it out loud and then keep going on. And you may or may not know whether that was normal. You may not remember it. Most times you don't remember what it was as soon as you leave the doctor. So those are the types of things that I think make really informed consumers, informed patients. You are a consumer of this healthcare product. You are paying for it. So in the same way you would research a new car, research your birth experience, have a birth plan. Show your birth plan to your doctor before you get into labor. Ask them, is this reasonable? I have women, and I'll tell you, sometimes that birth plan can be weaponized. So let's talk about that. When I was a resident, when a woman would come in with a birth plan, we were already offended because to us, it felt like, okay, they're going to buck. They're not going to trust what we say. They just about to go rogue. The thoughts are starting to shift on birth plans. But what I will say is that sometimes you have doulas and midwives who may be anti-doctor, anti-physician. And so they may introduce this birth plan as a means to say, don't let that doctor tell you what to do. Don't let that doctor pressure you to, and then they'll come in with this 100-point birth plan. And the reality is that we already were doing probably 98 of those things. People come in and say, I don't want you to clamp my baby's cord as soon as my baby's born. And we're like, well, we don't clamp the cord as soon as the baby's born anymore. We have delayed cord clamping. And so sometimes it creates a defensiveness that's not even necessary. So I would say create your birth plan as early as possible. Start thinking about it maybe at 28 weeks, anywhere from 28 to 34 weeks. Talk about it with your doctor at your 34 to 36-week visit. Does it sound reasonable? What on here do you already do? What can you do? What can you not do? Do you offer water birth? Do you not? Those are questions so that when you show up, you already know kind of what to expect. If you find yourself in an emergency situation, I would say the first thing to do is take a deep breath and continue to pray the same way you did, Life Coach Dunston. And then ask pertinent questions, and make sure they're explaining to you, even though it may be quick, that they're explaining to you and that they're giving you informed consent. This is where empowering the partner is vital. Dads, second moms, partners, husbands, wives, mama, whoever your support person is, they should be in those prenatal care visits with you if they can. They should be doing the research with you. They should know your birth plan and your wishes so that if something starts to go awry and you are either unconscious, you're foggy, you're tired, you've been in labor for 48 hours, they can know some of the questions to ask, and they can receive the information from the doctor with a more clear head and really advocate for you. Questions like, do we really need to go to C-section? Do we need to go now? Is this what you would consider an emergency? Do we have time? What are all of our options? Okay, explain the risk to me. Okay, we're okay. We understand what's happening now. And even they can even write things down. So those would be the things that I would say. And again, that's not medical advice. Listen, this is not just a disclaimer, but this is also a plea. If you have specific questions about your unique body, pregnancy, situation, plan, please talk to your doctor. One of the worst things you can do is say nothing. I had a patient one time, maybe about a year ago, who we went in, we checked the cervix, we explained things to her, we went back out, the nurses were taking care of her. She was there with her mom, and we would, come back in. Any questions? No. Any questions? No. Any questions? And about the fourth time we went in, because we usually go in about every 1 to 2 hours. The fourth time we went in, we said, hey, how are you feeling? What's going on? And she was just like bawling, crying. And she was Black. I'm Black. I'm like, what's going on? I feel like I've connected with her. And her mother just says, she's just so upset. You guys only come in here every 2 hours to check the cervix. She doesn't understand what's going on. She's confused. She doesn't understand why the baby isn't here. And I got on her bed with her and I sat there and I was like, I am so sorry. And that's when I realized my skin color wasn't enough to build that bridge. That I had to explicitly sit and say, no, make me know that you understand. Help me know that you have no more questions. Make me know that I've been very clear because this is your experience. So now when I walk into a room, and this is the way I train my students and my residents. Hi, I'm Dr. Carrie. I'm here for moral support. I am here to support your birth. I am here to support your decisions. Would you like your cervix checked? Would you like your water broken? If yes, let me explain what that really means and let me explain all of the risks. Do you want Pitocin? Let me explain what that is, all of the risks. Do you want to push your baby out on your back or do you want to squat? Do you want to lay on your side and throw your leg in the air? Do you want to do another yoga position? Do you want to get on all fours and push the baby out, with your bottom in the air? We can do all of it. What do you want to do? Let me uh, usher this life in the way you imagined. What has your imagination told you? And if we have to deviate from that, it is my job to explain in honest, authentic detail why we need to deviate and why my expertise has to override their imagination for their safety and the safety of their child. But I realize that that is my bridge to cross. That is my bridge to cross. And what I'm trying to nail down with the physicians that I work with, physicians that are all over the nation. I do this anti-racism training, implicit bias training, maternal health in Black women training all over the country and internationally. And I say, it is our bridge to cross. We owe reparations to our patients for what our ancestors did. Dr. J. Marion Sims performed hysterectomy and vaginal surgeries on Black women with no anesthesia. We have to repair that relationship. The federal government and doctors at Tuskegee performed experiments on our Black men, knowing that they were giving them saline shots and not penicillin, knowing that penicillin cured their syphilis. We owe reparations. It is not on our patients to come in here docile, meek, mild, jumping up for us, jumping through our hoops. We are the ones who have to build that bridge. So often you hear, even with the COVID-19 vaccine, people talking about hesitancy in the African American community, hesitancy, vaccine hesitancy, hesitancy. Why are we hesitant? We have good reason to be hesitant. We have good reason to distrust the system. And so I am like, no, 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 not on my watch. We're not going to victim blame. We're not going to Black women blame and shame. We are going to do our work because if there is a gap, if there is a bridge from where we are to where our patients are, that is our walk to make to meet you where you are. So I went on a whole sermon. I'm sorry. I'm a kind of a preacher too. So, but yes, what can Black women do and say?
No.
Educate yourselves, ask your questions, get your notebook, view your relationship with your doctor as collaborative, not hostile. Don't expect the worst. Actually, expect the best. Expect the best, expect partnership, and but also show up for yourself fully. Empower your partner. Bring your partner into the conversation, even if they have to work. If you can FaceTime them, bring them into the conversation, and make sure that you all are communicating with each other and with your doctor. If you have questions, ask your questions and don't stop asking until your questions are answered. And if you find yourself in a situation early where you don't feel heard, seen, valued, and respected, you can choose another doctor. That is always an option. So I just want to put that out there. But I do want us to, I will say, I'm starting to see a phenomenon where because we've dealt with so much trauma, so much racial trauma, birth trauma, trauma everywhere. I mean, Black folks, listen, long suffering is in the Bible, but I'm like, okay, we need a different fruit because woo, we have suffered long and hard. I'm seeing that some of us go into the patient doctor experience almost defensive, expecting the worst, sometimes aggressive. And that doesn't necessarily help your case either. So, doing your meditation, doing your breathing, doing your journaling, centering yourself, getting your pregnant feet outside on the ground, centering yourself in the earth, calling on your ancestors, calling on your higher power, having that grace and that peace and carrying that spirit into that interaction with you, that is what will start to shift some of these dynamics. So, and just being perfect. Black women, y'all already good.
Yes. Listen, Dr. Carey, you have blessed me on this day. The comments are amazing. Everyone's loving you because you are amazing. And you gave so much good advice. I'm sitting here thinking, man, why wasn't I talking to Dr. Carey when I was pregnant all them times? Like, sheesh, like I never thought of writing down my own vitals. And I will admit, during my first pregnancy, I was the one, no, I don't have any questions. No, no questions. No, every time, you know?
Yeah. And we
So
take
yeah,
that position
thank
of
you.
a
Thank
lot
you
of times
so
we
much.
take that position of powerlessness because that's all we know. That's what we've been taught. Doctor knows best. Just keep it cute. But I'll ask my cousins when I get home. I'll ask my mama. My grandma already told me. And so sometimes we forfeit our power in those situations. We forfeit our right our right to ask questions, to know, to understand, and to be informed. And so we have to reclaim our power. And you said, say it for me again, because this Black Maternal Health Week is about reconciliation, reclaiming our power, reclaiming our position, and coming for what we're owed, coming for all the good things. So, yes, do you have it written down exactly the phrase?
Yeah. So yes, it's claiming our power, resilience, and liberation.
Yes. And I'm gonna throw in there, like from Auntie Maxine Waters, honey, reclaiming my time, reclaiming my
Yes.
time. So we've been owed for a long time, and Black women are coming to get what we're owed. We are owed a healthy, safe, sacred birth experience, and we are coming to get it.
Amen. Okay, so Dr. Carey has preached this sermon. Um, I would say pass the collection plate. However, they can visit your website and purchase your journal. Please tell our viewers about your journal.
So I actually have a copy of the journal here. It is called Envision, a vision journal on loving yourself whole. And so this does not actually have a separate entity from the conversation that we're having today. Because what I'm finding is this journal is resonating with mothers, with Black mothers in a way that I could not have imagined. It goes through every single phase of life. So there's a section for what your family looks like, family planning, exercise, dieting. What are we putting into our bodies? Gratitude. How do we center ourselves with meditation and gratitude? It has a section in there for finances. If you are planning a family, what does your budget look like? How will a child affect your budget? Just different things like that. And so I found myself In 2014, I had the perfect life. I was a physician, married to another physician. We had the world was our oyster. I had landed a great job, and I was dying inside. None of it was divinely inspired. I was going off of what I thought I should do. I was ticking the check boxes. I was becoming who I thought I should be. One of the first questions in this journal, in the spiritual inventory section, there's a mind, body, spirit section. One of the first questions in this journal says, who are you when you strip away the titles? When you strip away being a wife, a mother, a daughter, a physician, a social worker, a banker, when you strip away the titles, who do you know yourself to be and what is your truth? And I developed that question because that's the first question that I felt like God asked me when I was at rock bottom. And I can say now that that was my rock bottom. When I was in that valley experience, the question was, well, who are you? Do you know who I made? Do you know how I see you? Do you know what your truth is? And when I was able to articulate that, to write it down, to embrace it, I was then able to start piecing the rest together. So I know you do mental health. We have a mind section in here that has a mood log. We can have a whole nother conversation about postpartum depression, about depression of being Black in America, of watching CNN and watching them play the videos of our babies, of our men being looped on repeat, these murders being looped every time you turn on CNN. And so, how do we maintain our peace? How do we keep our minds intact? So I have an entire section in here of mental health that teaches you how to meditate, that teaches you how to track your mood for 4 weeks. Is my mood going up and down? Is it stable? Did I have a scenario that was conflicting me? How did I react? I had a young lady that told me she loved this journal. She hit me up on Instagram. She found me on Instagram. She DM'd me and she said, I love this journal, but Dr. Carey, I had to put it down. She said, I got to the first question in spiritual inventory and I had to put it down. And she was like, I couldn't pick it back up until I took it to my therapist because I realized that when I stripped everything else away, I could not answer these questions. And so she took it to her therapist and they worked through some stuff. She unrooted some stuff. She dissolved some trauma. She learns how to manage her emotions better. So when I tell you this was divinely inspired from my personal experience, me having to go through a divorce, me having to quit a job that everybody thought was good, me turning down another job that paid 4 times that job because God said, no, this is not your purpose yet. And then moving into the divine manifestation of what I'm doing now that even brought me to you. Helping Black women navigate life, building families, building relationships, freeing white identifying people from the constraints that racism put on them. My anti racism work is freeing white people every day that say, my granddaddy taught me this. I don't want to do that anymore. I thought I was giving good care to my patients, but the numbers don't look right. What do I do? How do I get free? How do I connect with Black folks? How do I connect with Asians and Latino folks, Latinx folks? How do I treat my transgender patients the same? I've never met a transgender person. What does that look like? Why do you say Black women and Black birthing people? Why do you say that? Why do you use pronouns? What does that mean? So I wasn't even, you asked the question, why wasn't I talking to Dr. Carey when I was pregnant? Because I didn't know then. I didn't know in 2010 what I know now. It's been the process of self-searching, soul searching, and it's literally I put it in journal form because I wanted you guys to be able to walk through the process that I walked through. The last thing, so most people know about vision boards, but this is a vision journal. So in the journal, there are vision board spaces. So you can take your magazine clippings and go through and put them right on the journal like you would do a vision board. But it also has quotes. I don't know if you can see that there. It has quotes, it has the vision board pages. What do you what would you put on this page that says beautiful, happy, beautiful, happy, beautiful, happy? What would my life have to look like for me to feel that all the time? So that's how the Envision Journal was created, from a manifestation of the phoenix rising from the ashes. And I really, it's been a blessing. I want you to have it. And we will do a special discount code for your viewers, because I want you all to be able to get it. So let's do Envision 2021. Envision 2021, because we are going to take this energy, take this advocacy, take this vision, and we're doing this all 2021. So if you go to the website that's scrolling on the bottom, myenvisionjournal.com, insert the discount code Envision 2021, and we're going to have 11% off for you. 11 is the number of vision, and I want your followers to be able to take advantage of that discount. So thank you so much.
Thank you, Dr. Carey. Your story in creating this journal literally gave me chills. Um, I've been a life coach for a while now. I've been a life coach for 8 years now. Um, and I became a life coach because of my own From Pain to Purpose story. And I wrote my workbook based on my story and wanting to help other people find their purpose out of their pain. And so, like, I was so inspired while you were talking. I was up here ordering the book. I was like, let me buy this journal. So I would place my order without the discount code. It's all good though, because, people need these things. And now I'm up here plotting, like, okay, so how are we going to work together again? Because y'all, Dr. Carey is a whole life coach. We didn't discuss that, but yeah, she is. So we have to work together in a
Yes.
different way
Well,
to
thank you
help
so
people,
much. Yes, this
they
has been
need.
beautiful. I will tell you this, my spirit always knows when I'm in a sacred space. My sacred spaces are when I am walking in my purpose and I have aligned with someone walking in theirs. And so you have created a safe and sacred space for me today, and for Black women everywhere. And I just want to say thank you. Thank you for the work you do. Thank you for your relentless pursuit. Some people, you see life coaches popping up everywhere. Life coaches popping up everywhere. And it's one of those things where you can tell the spirit is tried by the spirit, and you can tell who's in it because that's the trend. They feel like that's a quick way to make $1. They got fired from another job and they just went on and got a certificate overnight. And then you can tell who's in it for the pursuit of healing the masses, the pursuit of wanting people to live well. And that is who you are. Like Dina said, that's who you are, period. Pooh. Okay. So thank you for being all of that. Thank you for inspiring me. Matter of fact, I slid in your DMs one time and I was like talking like I had lost my way. And you was like, girl, bye, period. Like, Black women are perfect, period. So thank you for being all that. And I cannot wait until our worlds collide again. There is definitely Black girl magic to be made. And I will say my new brand, that has sprung forth from the Envision business is Black Girl Visionary. And you, Life Coach Shereka Dunston, are a Black Girl Visionary.
Thank you. Thank you so much. And thank you, everyone, for joining us. This has been a pleasure. This has been great. So make sure you share this replay on your timeline in groups. Help other women, help other birthing people, spread the love and buy the Envision Journal at myenvisionjournal.com.
Yes, with
Y'all take care and have a
discount
great
code Envision
weekend.
2021. Okay. Bye. Thank you.